Are you ready for All Access Sports Medicine, the team that treats at the highest level with cutting-edge medical care?
Good evening. This is All Access Sports Medicine. I'm Adam. Super excited to have everyone here, and we're kind of in a different setup again today. I'm in the middle seat.
Is this our new feel?
I don't mind it. I don't mind it.
We're here to tolerate things.
Well,
huh?
Little does he know, I gave him the bad chair.
You did. I'm like, I can't. Is that why you kept asking me why you're adjusting your chair?
Yeah, I had that chair last week.
Yeah,
it's awful.
Is it a rocker?
Don't say awful. That's a bad word.
It is not as...
You weren't able to tolerate it.
There you go.
Okay.
I can't tolerate it as much.
All right,
but not talking about chairs. We're talking about All Access Sports Medicine here today. As always, on my right, I have Dr. Dana Ponners from OMPT Specialist. So happy to have you.
Thank you. Happy to be here.
You ready to be here?
I'm ready to be here today.
You ready to talk about hips?
Absolutely. All about hips today.
It's all in
all
the hips.
All about the deep hip
it's
joint.
all in the
We may have
hips.
to get up and demonstrate.
Okay. Are you ready salsa? You want to do some salsa?
No,
dancing?
I mean, you're putting out all these videos, and you got a lot of hip action going.
No. Don't just
we
throw
can't-
out my videos here.
We can't just roll with that.
Yeah, let's not do that.
We
But
might have to make our own.
we could, yeah. And I guess
TikTok right here.
I have to introduce Dr. Jeff Pierce. That's on my right from Michigan Sports and Spine Center. So happy to have you on board.
I'm glad to be here.
You are glad. See, there's that smile. There's that smile. And of course, throughout the show, we're going to be talking about hips. Hips are going to be our, I guess, medical deep dive into today. Is the hip
hooray.
Hip hooray. And we also have Dr. Jeff Carroll here. He is actually a hip specialist, so we're actually excited to have him come on board, give us a little more insight. But he's here as our thought leader of the week, a good friend of Dr. Jeff Pierce, so we're excited to have him on board. Additionally, our hero of the month, this is the last week we'll be talking about Athletes Unlimited.
We'll always be talking about Athletes Unlimited, but it'd be the last formal.
Okay,
week.
The last formal conversation that we have for Hero of the Month for Athletes Unlimited, and we have Ayman Al-Asari here. I'm actually excited to have him because we talked to him 3 years ago.
I don't know. It's pre-COVID, post-COVID, and yeah, that just happened.
Yeah, so we talked to him about 3 years ago, and that was when he was on his way to Arizona, and now engineer, working for GM, trying to start a little comedy career. So excited to.
He's got a lot in front of him.
Yeah. So keep in touch with us. Stay here. If you do have any questions about the show, if you have any questions about your hip issues, feel free. Shoot us a call. Bring us into the fold on Facebook and YouTube, and we'll actually answer your questions live on air. But when we come back, we'll have the thought leader of the week, Dr. Jeff Carroll, when we come back. Thank you.
Welcome to Michigan Sports and Spine Center, Michigan's top physical medicine, rehabilitation, and regenerative medicine specialists. We are a team dedicated to providing you with the very best in patient-centered care, including personalized, cutting-edge treatments for all musculoskeletal injuries. Visit one of our convenient Metro Detroit locations to get started with a comprehensive exam, pain management, biologics treatments, EMG testing, and more.
Let's take you backstage with our thought leaders of today on All Access Sports Medicine. Thank you to our friends at Michigan Sports and Spine.
Here we go, All Access Sports Medicine thought leader of the week, Dr. Jeff Carroll, board certified orthopedic surgeon from Movement Orthopedics. So That's happy to have you on board here, sitting in the comfy chair. We called it the comfy chair, but I get yelled at all the time for how our chairs are feeling. So I'm just going to ask you straight up, how comfy are you?
It's pretty comfortable.
All right. Well, how comfortable are you with this guy to my left, Dr.
That
Pierce?
guy I'm not so comfortable with, but he's okay.
Right.
It's like a secret sauce. You just have to get used to it.
Okay. All right. Well, we're so happy to have you on. We're definitely going to be getting into the hips, getting into Bryson Dechambeau and how he's definitely not been playing very much. And of course, before the show, we talked. You play golf, right?
Yes, that's right.
All right. So has a little bit of insight, not as much as Dana here. She was going all bore last week talking about Bryson.
Slow her down last week.
We did. So we thought we would keep going with that conversation. But beforehand, I definitely want to say, The relationship between you and Dr. Jeff Pierce here, how long has it been? What are some things that you guys have done together?
Sure. So a few years. Jeff's a non-surgical sports medicine doctor. I'm a surgical sports medicine doctor, so a little difference there.
Okay.
And how we treat patients and what we do. But yeah, I'd say a few years collaborating here.
All right. And
it's an early marriage, so.
well, for a few years is early. Okay.
No, I mean, basically, like Dr. Carroll is saying, I mean, we take a non-surgical approach. I mean, Michigan Sports and Spine's all about non-surgical, non-narcotic, how we treat it, holistic ways. But a lot of times, the reason Jeff and I have hooked up is because he is a surgeon that understands the non-surgical ways and how to implement that.
Okay.
And if we do need surgery, he's the guy to go to. And, I mean, that's kind of where what I search for. I've been out long enough. You kind of know when you mesh or have the same philosophies as certain guys. Certain orthopedics are like, nothing can be fixed unless it's, you do surgery.
Yeah.
I mean, Jeff knows that, Dr. Carroll knows that there's other methods to do or work together. Like we talk about scopes that can be followed up with PRP or biologics and better healing rates and things like better recoveries and things like that. So he's also pro biologics with PRP and stem cell, which I know he does in his office himself.
Okay. All right. And I guess any more insight on that, and then definitely, I guess, your specialization of hips.
Sure. Yeah. I agree with everything you said. It's definitely a team effort here. So it's not just surgery or injections or therapy or massage. There's all sorts of modalities that we use. So it's definitely a team approach and just a cog in the wheel.
Correct. and of course, we always have the physical therapist side on the other end here for that 360 kind of approach. And Dana.
Absolutely.
There you go. Well,
we call her the bartender part of it. So we get to sit with the patient about 15 minutes, 20 minutes after the first initial. She's with them for 60 to 70 minutes.
I'm cleaning everything up.
Yeah, there you go. Right. Or you're
that's why we're only as strong as our best
therapists. Getting them back moving, right?
Absolutely. Wiping down the tables and cleaning it all up.
That's right.
Yep.
Doing all the hard work. So I guess she's doing all the hard work.
I think
or you guys
Dr.
doing
Carroll
the
and
hard
I would definitely not argue if we accuse the therapist of doing all the hard work.
Okay.
Right?
That's right.
I mean, to be honest, I've always said it. I don't think you would disagree that we're only as good as the therapist we get you to. That's why it's so important to get to a skilled therapist, because if he's doing surgery and the therapist doesn't know what's going on, then your outcomes are there.
Yep.
We've done everything. How many times have you had a therapist not know what they're doing, jump the gun, and ruin a repair or premature?
They can be your best friend or worst enemy for sure.
Yeah. So, like for the listeners, for sure. I mean, it's important. We always say not every therapist is created equal. Not every physician's created equal. I mean, here it's at All Access Sports Medicine. That's really what we're trying to promote. That's why I asked Dr. Carroll to be on, because he understands that team approach. He understands that there's multiple people involved in your recovery. You have some surgeons, which I dealt with in Chicago. It's like I deal with the Chicago Bulls. I fixed them. You're okay. You can go. And I'm like, okay, but if you're really dealing with the Chicago Bulls, you have a trainer, a therapist, a long road before that person actually sees any activity. And that's the same in the way we treat the patients. I mean, I don't think anybody will argue with that. I mean, a lot of surgeons, and I'm not going to call out names, but orthopedic surgeons are king of, I fixed it, they should be fine.
Yeah.
And Dr. Carroll doesn't have that. He understands the team approach and how important it is that you want full recovery. You get muscle atrophy after a procedure. All that has to be done. Like, you're looking at a lot of players right now.
Mm-hmm.
A lot of professional players are sitting on the bench right now. You know why they're sitting on the bench? Because of that recovery time. There's so much more studies being done on re-injuries, so they're taking a little extra time. Especially like I have a young athlete right now. He's a lacrosse player over at Cranbrook. I mean, that's what we're talking about. We can get you ready for the first game.
Correct.
But it's more important to play at the end of the season or at the beginning of the season.
There you go.
We have that luxury right now. I mean, you deal with a lot of athletes too. It's all about where you want to be at the end.
And athletes never want to be disrupted. I mean, that's the big factor there. And one of the things that I wanted to kind of bring to the table today is rehash out the Bryson Dechambeau hip and left hand.
We should do a flashback to last week. We calling him out.
No. We're not going to do a little flashback. But he is, this year, Bryson has probably been one of the most disrupted players of the season as it has started. He started that the first tournament, I believe. I want to say the Sony, but I can't. I'm mispronouncing it. But he ended up playing 4 rounds in that tournament and hasn't played 4 rounds since. I want to pull up the clip of Bryson's swing. Let's take a look at it. I want to break down the mechanics of it, but I want to kind of just your initial reaction of what you're seeing from this video right here, Dr. Carroll. Again, over and over, swinging out of the shoes, putting in the miles per hour at the bottom there.
And again, just to draw, it's his left hip that he has a labral irritation or injury with right now. So that's why he's out, is because he's a right-handed golfer. He's about 28 years old. And it's his left hip and his left hand that are concerns at this moment.
Mm-hmm. Dr. Carroll, are you seeing golfers, or I guess are individuals like, I don't want to say this stature, but coming on in saying, hey, I've got some hip issues, hip problems, things are going on?
Sure. Yeah, super common. Big issue with golf is that, and like many sports, it's rotational. Mm-hmm. And especially with the hip rotating with that kind of torque, very common to get labral tears.
Okay.
So this is not the first professional golfer that's been sidelined from a labral tear. It's very common, especially in the younger golfers.
And are there any, I know we talk about prevention here, are there any types of, I guess, and this is kind of both all ends of the spectrum on this.
You're throwing it out there.
Yeah.
No, I mean, kind of what we talked about last time. I know we had Darren on last week. We kind of went a little different direction. But when you do look at anatomy, and I'll let Dana explain it again because she does it better than I do. But you are looking at a ball and socket. You're looking at bony joints, and then this little labrum that kind of holds that joint in together. So we would just go over the pure anatomy. I thought we had something.
Is the labrum the buffer? We're talking the little buffer between the ball
no.
and
It's the ligaments that holds it in tight.
There you go. So. Yeah.
We have another
special guest, your daughter, just dancing in the background as the show is going on. Thank you so much, Paige. Truly appreciate that.
She's in from Boulder.
Okay.
This is a special day. She surprised us just now.
Well, so, getting back into the labrum, it's the tendons?
It's part of the ligaments within. Okay. So, I mean, it holds the joint in tight.
Okay.
Like Dana said last week, it's a small ligament in between bones that's creating that friction. And when you look at that pivoting position, so they always teach you when you're golfing, you got to keep that left foot pretty much just down on the ground.
Keep playing that clip there, Spence. And so again, go ahead.
No, so you're supposed to keep that foot on the ground. If you do, you're rotating through. It's putting more torque. You see his left foot starting to come off the ground to take away. So you don't know. Proper form, that foot's not supposed to move that much. Mm-hmm. But that's what goes against, this higher torque. Like last week, again, maybe get in trouble this week. Again, calling Dechambeau out, you're all about the science of golf. We looked at it. You looked at it from every aspect. Now he's doing it, what rate he can, speed he can create. But again, has he taken a look at what friction forces he's dealing with his body?
Well, I have a quote from Bryson that actually was in an article. He added that people are going to say it's off of speed training and all that, and sure, some of those things have been part of that. Just abuse or working really, really hard. So he's saying people are saying, it is the speed training. He's not saying no, but he is saying that he is training the hardest he's ever done. And I'm kind of going back into the Dana side here is. Saying he's training the hardest he's ever done, but is that what he should be doing? Because clearly he's not doing something right.
I think it's kind of how we mentioned the number one thing of getting a labral injury, which you just said also we mentioned last week, is rotational forces. That's what causes uncontrolled that's what causes more than speed training. Mm-hmm. If you're speed training, you lose your footing and you're in a cleat or something, that's how you're going to tear.
Okay.
So who can say when it happened or anything? I guess the point is at this, what are they going to do, to get this guy back to golf this season? I mean, you got the Masters in 2 weeks.
Yeah.
What is possible here?
He's probably looking at a surgery, probably looking at hip arthroscopy. You can think of the labrum as like the suction cup around the socket that keeps the ball in.
Okay.
And when that thing tears, it's super painful. It's like someone pinching the hip.
And so this is, in your opinion, is he feeling that pain every single swing he's taking?
Yeah.
Probably.
And that's very difficult to get that to heal without surgery. Depending on how big the tear is, the location of the tear, and some other factors, but it's pretty rare to be able to get that one to get better without surgery.
Duh. I mean, kind of a little bit up against it, but
well,
we'll do one little,
yeah,
one
I mean,
little
I
take.
definitely agree with Dr. Carroll. You know, at his level, I mean, we talk about PRP, we talk about stem cell, we talk about prevention. Are these things that can happen? If it's torn, if it's completely torn, no. If there's a partial tear, then maybe we can go ahead and work with the PRP, work with the stem cell, and try to create some healing, some matrix there to create that non-surgical thing. But if it's a complete tear, you're looking at a high-level athlete like this, it's more than likely because he doesn't have that time or that ability to wait if it works or not.
Correct.
So that's one of the biggest decisions. It's like, what's your goal? When do you have to be back out there? The quickest proven way right now, if there's a complete tear, you got to go in there and repair it, you know, to restore what's going on now. But also, you know, if it is torn, he keeps pushing on it, says, I'm going to wait, and he's going to fight through it because he's professional. You know, there's ways we can get him out there. There's injections, there's therapy, there's things like that. But now you're creating possibly a premature further injury to the hip and wear and tear on that joint, which is going to, you know, hopefully after he retires from golfing. But
he's only 28.
These guys aren't retiring very often there.
Yeah, you also got to remember that, you know, if you don't fix these kind of tears, when he gets older, he's looking at hip arthritis and maybe hip replacement.
Correct.
So
right. And that's a super detriment.
That big hit to a golfer.
Well,
alternatives, though, too, is what you talked about, other ways to keep him, injections and that to keep him going if that's what his wish is for this year. I mean, like he says, I want to go play the Masters this year.
There you go.
So there are alternatives to help him, which is going to be therapy, again, injections, that kind of stuff into the hip. But also, he might have a trainer right now. He's got all kinds of coaching staff that might be trying to change his swing, maybe to focus more on a different part of his game that will at least keep him in.
Okay. Whoa.
I mean, that's a possibility because you know these guys are
Look at this
constantly
one.
looking at changing things.
I'm going to argue.
You think yeah? Well, what if
He's
that was
not
his
gonna
goal,
change.
though?
He's not changing.
Let's just wait a second. I'm going to go to break. Let's get your arguments together. When we come back,
It's not an argument. It's just a nice
It's a challenge.
conversation.
When we come back, we'll do the medical minute. We'll keep going into the hip and getting into this conversation. I really want to see this argument, but that was the thought leader of the week, Dr. Jeff Carroll. So happy to have you here. Don't leave. Stay in the comfy chair. But for over 25 years, Michigan Sports and Spine Centers have been providing complete care in the world of sports medicine, rehabilitation, and regenerative medicine, using proven cutting-edge treatments and dedicating themselves to overall health improvement, and patients recover at rates well above the national average. To schedule an evaluation or to find out more about biologics, pain management, EMG imaging, and physical therapy. You? Services, call 248-426-9944 or visit them online at michigansportsandspine.com.
You need an MRI.
You got to hold it together.
A facility that makes your comfort and exam quality top priority.
How you doing over there?
MRI of Southfield provides Metro Detroit's most advanced imaging while maximizing patient comfort. Our truly open Hitachi Oasis system features an unobstructed viewing angle and the most accommodating patient table that no other MRI system allows. Patients and their doctors enjoy fast results without compromising safety, performance, or efficiency. Contact MRI of Southfield today to schedule an appointment or to find out more about insurance and pricing.
Welcome back to All Access Sports Medicine on Woodward Sports. Here's your Medical Minute, powered by MRI of Southfield.
You that debt left us? I hope not. But for those of you that did stay on, I have Dr. Jeff Pierce to my left, Dr. Dana Ponners to my right. They're about to get in this little argument about hips.
We're not in an argument.
I want to see
There's
it.
no argument.
Nothing?
Arguing with me.
They're cutting your mic off because they feel like you're going to start screaming and yelling. So hold on for a second. Hold on.
No. Let's go back to it. I mean,
Okay.
basically, Dana brought up that Bryson may go ahead and switch his technique of swing. This guy has gone so hard and committed. I don't see him giving up at this moment on his style of play.
Okay. So what if,
I'm going to rebuttal that.
What if it was really important for him to stay in the game and do the Masters again? That was his dream. and he's going to do anything he can to make an appearance there. So he can.
I think he'll adjust it. You're not going to see him going down to a nice, easy swing. His game is powerful.
It is powerful.
But the thing about professional athletes, let's go to Tiger Woods. You have to constantly reinvent yourself. Like things are going to come up with time. With
I was waiting for you to
age
bring
of
that
hips
up.
and that kind of stuff. And we can talk about that. But then you're going to you're not going to just give up on your sport. You're going to get a team of professionals to help you pick out the best things of your swing.
Okay. Scooch back
a little bit. So, like, we've had discussions before.
Now he's got to see. Now we're
arguing. We're having a discussion before.
You see what that goes? See how immediately we're not arguing, but
bringing up positive points.
No, the positive point. You can surround yourself, and you know this, when someone is mentally committed. And Tiger Woods is a great example against what I'm going to say right now, because he is someone that said, I need to reinvent myself. But then again, you're still surrounding yourself with people that will be agreeing with that person. So I'm not saying I'm close to the Dechambeau team or the theories, but there is thought that everybody around him supports his philosophy. They don't challenge him.
But are they yes people? Or
I can't. I'm not going to sit there. I'm already in trouble challenging him from the physics of the science of yeah, we're hoping All Access Sports Medicine gets picked up by Dechambeau. That would be a huge thing. But I would love to have the discussion with him from a science standpoint and make sure Dan is at my side to back me up. But basically, what is he going to do? He does have to come off of what he's doing. Can he keep doing it? And he was asked this very early on, what are you going to do? You are changing it. You are increasing the philosophy of how you go at it. And he had all the science of why he did that. And I watched a couple specials on that. But you never heard, like when you talk to the physician, Dr. Carroll is shaking his head over there. When you talk to the physician, we kind of saw it. We saw it coming. We saw it like nobody is surprised from a physician standpoint that has any inkling of sports medicine.
Okay.
So, we're really picking on him hard. We got a few other people, but I mean, Dr. Carroll, there's no, like you said, this is so common, so commonplace, and he's pushing it at a faster level. When you talk about a normal golfer or someone who doesn't play as much, this happens years down the road.
Well, again, we brought this up. Bryson, Tiger, they hit in that speed all the time. Every day they're hitting 1,000, 2,000, however many thousands of balls, shots that they're doing at that speed, at that rate. An everyday golfer might have that speed and rate, but they're not doing it every single day over and over and over and over again.
Right. I mean,
that's an issue.
Like we brought up last week with Darren. I mean, machines do it. Machines test the clubs out. We're not a machine. We wear out. There's joints that wear out. Look, at the end of the day, it's his decision. I mean, he's going to surround himself. He's hearing it. He knows it. And to be honest, he'll probably start reading on it and he'll study it and he'll probably figure it out himself. I think he was more worried about the science of the game instead of the science of the body, thinking, he put on how much pounds of weight of muscle in 1 year. I mean, that alone.
It was like an off season. I don't even think it was a year. It was an off season.
Yeah. I mean, that alone, I'd like to know and be able to have a nice conversation with him. What did you study on your body? You built up the strength. Do you understand that the ligaments are the weaker part of your joint? That's the weakest link. And you're still pushing that hard with that muscle. So, yeah, it would be a great conversation. We invite you on anytime on All Access Sports.
Come on out to All Access Sports Medicine. We can bring you in virtually. How you can come into studio. Just come on down to Detroit and
get the comfy chair.
Yeah, maybe it'll be during the
Rocket Mortgage.
Rocket Mortgage. There we go. Wow. Yeah, it could be something we could do there.
So then
we're here to help. We're here to help him, not to challenge him.
So let's say he does. We talked about it. There's an injury to the labrum, and he has to have some sort of surgical intervention. What are we looking at then?
Yeah.
What would we be looking at for time frame for a professional athlete?
Typically, you have to have a discussion with the player or the athlete. Do you want to end your season now? Start your recovery now? Do you want to try to finish the season? So the discussion is always with the athlete to make a decision about that. And, after the decision's made, then you can talk about options. Now, there are some options, conservative options. I would say therapy for sure to maintain motion, maintain strength, especially core strength for the hip, and different types of injections, including PRP, stem cell type injections are options with these kind of things. They're more experimental, but there's been some literature that says that they're supported. Cortisone shots just to kill the pain is an option to get you through the season. So there's some definite, there's some things you can do.
And usually, what is the percentage of the players saying, let's do it now?
Yeah, it really depends on the function, how good they are. Now Bryson could probably make some adjustments to his swing, maybe lose 5 or 10 miles per hour off his swing and still do fine, and maybe even qualify for the Masters or for the,
play the full season. There you go,
and do very well. But if he misses a couple cuts and then makes the decision, hey, I can't do it, maybe opts for the surgical option, rehabs during the rest of the remainder of the season, and is back, full go for the next season.
I think a lot of times professional athletes I would say in the golf setting, they want to come to the tournament. They want to be there. They feel good. They start playing, and then they find themselves 18 holes in going, nope, not going to happen. And I think in this setting, Bryson played the first 4 rounds of the season, and then since then has missed every cut due to disqualification and pulling out. So,
yeah, he's got to be ready.
Is that hindering his kind of psyche to say, you know what? Not only am I losing that, but I'm not playing.
No, but Dr. Carroll says it perfectly. It gets down. You have the discussion with the players. Like I said, I mentioned the other gentleman, the lacrosse player, he's 17. Where do you want to be? When do you want to be ready? What do you want to do? Because you do this, there's a commitment, right? So a lot of these guys, if they can't perform at their best, it's like, why be there? Let's knock it out. But there's a whole play to them to understand that I'm not there. I can't make the cut. I've made the adjustments. I've done A, B, and C. I tried the injections. I tried the medications. And if it's just they're still not able to compete at that level, and we don't even realize how difficult it is to play at a professional level. It's such an elite level. Like golf. It's one stroke making differences.
True.
If you're missing it, and now you're missing it on 3-4 times on every 18, it's adding up where you're not really competing and you're doing the best. So it is that conversation, but he has to be mentally ready. Like I can't do it. So, and it's at every level. It's not just at Dechambeau's level. And we're doing it with hockey players. We're doing like every day. We're doing it every day in the office. We're dealing with it. Like I mentioned, my Olympic gymnast at 12 years old. We got to back her down because I want her good at 13, 14, 15. Those are the things. Those are the conversations. Fortunately, we have parents there. Dechambeau, you got to talk to an agent. You got to talk to the lawyers. You got to talk to his trainers. When I was dealing with when I'm doing with the entertainers, like McCarty brought up, me dealing with entertainers, we just had to pull back on a concert, which in 22 years is the first time we've ever had to cancel a concert. It's been down for 2 weeks because the lead guitarist couldn't perform. So it's you got to talk. You got to take into all the factors. As far as recovery, labral tear, if you keep it simple. The other issue, Dr. Carroll, is that if he keeps playing on it, if it's a small partial tear, it's an easier fix. He keeps doing it, that thing's not going to hold up. You got a weak link in that hip, and I don't care how much he slows that swing down. No. He still has to put in a lot of swings to maintain his competition.
Let me add one quick dimension to this too that we haven't spoken of, and it doesn't have anything to do with the hip. Although he also has a hamate fracture of his hand that I read about, which is one of the 8 bones.
He was saying that it was from a table tennis accident in Saudi.
Yep. So hamate is one of 8 bones in your hand, and you have 2 fingers that articulate that with the hamate bone. So his grip strength is going to be off. So his 4th and 5th fingers, usually if you have some sort of pain with your hand, that's a possibility too. So that's just throwing it in for his total rehab, like considering what he might do.
She's really pushing for the change in Bryson's swing. Now she's going for the grip.
Left hip, left hand.
Girl. I love her.
He's got a couple things going on. I feel bad for him.
We can help him. We can help him here on All Access Sports Medicine.
I think, definitely have talked about this in a little bit of nauseam now. And I think getting back into All Access Sports Medicine and kind of why we're here is talking about prevention. The everyday person the weather is warming up, they're getting their golf clubs out, they're going out there, they're going to start to maybe try to swing as hard as Bryson. I think we
highly recommend.
I really want to take this next 5 minutes to talk about some prevention, how individuals are going to be able to maybe do some stretching before they're getting ready. I've been seeing a ton of videos about hip flexor stretching, and you make sure your hips are this. Is this stuff just fluff, or is it true? Do I need to make sure that my knee can touch the ground and get my hip, get some stretching out there?
I think Dana wants this one.
I just want to add, so that's a big topic that we're talking about. When you're talking about golf, and you just said, do I need to get my knee to touch the ground? I think the best stretching for a golf swing is something that's going to be in that posture.
Okay.
So you don't need to be getting down onto the ground and that kind of stuff to stretch out your butt or stretch out your hip flexors, knee to ground. But you can just do it in a standing position, because that's how you're going to address the ball, and you're going to go ahead and that's going to be the most efficient way for you to do your warm-up and your stretches before you go right onto the golf course.
Okay.
So basically, yes, hip flexors are important to stretch, because if they're tight, they're attached to your back and they're attached to your knee. They're a very intricate type of muscle group, because they're very long in the front, where like your glutes in the back, they're more power and they're short. So hip flexors are important to stretch, especially because of the rotation and the hip motion that you need for the swing.
Okay.
It's also going to be important for you to have kind of upper body stretches for posture for golf, and maybe doing some sort of like neutral squatting activities, because your golf swing is kind of a squat activity. We talk about lateral movement. There's weight shift, left to right. So the side muscles of your legs are going to be important to stretch. All that can be done within 5 minutes right before you warm up to go ahead and address the ball really quickly.
There it is.
Yeah, I mean, absolutely. 5 minutes for the young people. For
it's older people that take a little longer.
If we're on
Ideally.
the back nine,
if we're
on the back nine, then what do we do?
But the question the patient should ask us, or the golfer should ask us, when do I know I'm ready? When do I know? You have to feel like you wake up early. If you like the early morning times, you know how your body's reacting. It's that rotational, everything that Dana's talking about. But the only thing, I want you going through the motion that you're swinging, the activity that you're doing, the rotational. Take the practice swings. You need to, make sure everything's stretched out. But, is it 5 minutes? Is it 10 minutes? I know guys, when we're rehabbing them, I want them out there 20, 30 minutes before warming up. Hit a few balls. Don't hit. You start with your smaller irons to begin with. You want that easier swing. So when you start, when your body starts feeling that it's loosening up. I mean, a lot of people tell me it's by the third hole because they're through the first drink, but that also helps. For them.
Yeah.
There's no joke to it.
No.
I mean, there is some validity to it that loosens their body up, whatever they need to do. If it takes a couple holes, the guy that gets there right before, he's no time to warm up. You're prone to injury in those first few swings, so don't go at it right away. So,
and I concur, because you were just talking about flexibility. So that's the flexibility portion. But absolutely, a brisk walk, 3 to 5 minutes, 10 minutes before you go in. Everything Dr. Pierce said, that's going to get your body ready and going through the motions. That's hugely important. Playing hockey is different than golfing.
Yes.
So you're going to have a whole different set that's going to be better playing hockey and different muscle groups in the hip that you're going to address as opposed to golf.
Dr. Carroll?
Yeah, I agree with
Thought
everything.
leader of the week.
I agree with everything that's been said. The rotational exercises for golf super important, where maybe not as important for other sports. And the core, you just can't go wrong with strengthening the core.
Okay. And when you say core, you're saying front and back? Or?
Front and back,
There you
so
go.
abdominals and all your long muscles of the back.
All right, well,
was that 5 minutes?
that was it.
Really?
That's, you know what? That's the.
No, we got a lot more.
We could put up videos on how to do this kind of stuff if we
There
were a
you
little bit
go.
more prepared,
Well,
right?
well,
Dr.
you know
Pierce
what?
could be doing the rotational stuff
Yeah.
and some
I did some
hip
TikTok
flexor
rotational stuff.
stretches. Yeah, I think that would work.
All right,
for-
David, you're on there, right?
So that was the Medical Minute by MRI of Southfield. MRI of Southfield has been at the forefront of providing advanced open MRI services for Metro Detroiters for over 20 years. Their state-of-the-art Hitachi Oasis open-sided MRI system provides patients with a spacious and comfortable experience while providing the highest quality imaging for you and your physicians. To schedule an appointment or to find out more about insurance and pricing, call them at 248-354-5511 or visit them online at mriofsouthfield.com.
At OMPT Specialists, we focus on you by providing one-on-one care. And that's when you see the real results.
When I consider the one-on-one approach to physical therapy, I was really happy with that idea. We had been to several other physical therapy clinics, and OMPT just really stood out.
From back pain to post-surgical recovery to chronic pain, when your doctor refers you to physical therapy, opt for OMPT Specialists.
At Wing Snob, staying humble's not our forte. We just have better wings. We're back at it again with our crispy golden brown fries and our famous boneless wings. Juicy, tender, hormone-free chicken. Your favorite signature sauces with no bone. Just when you thought Wing Snob couldn't get any better. Order online at wingsnob.com today. Wing Snob. We just have better wings.
Hi, my diamonds. It's Crystal with an X. You want to get hot and perfect like me? Here's my super easy routine. Drink at least a gallon of water before you wake up. Attach a weight to everything in your house. Hello? Sell your car and just sprint everywhere. Scream when you exhale.
Don't follow Crystal with an X. Do your own thing at Planet Fitness with tons of equipment and free fitness training in our clean and spacious clubs. Join now for just $10 a month and cancel anytime.
Fellas, let's be honest. We like things to be easy. We like simple stuff, like sports 7 days a week. We like things uncomplicated, like Lady Jane's Haircuts for Men. Open 10 to 8, 7 days a week. Walk in anytime. Sign in, sit down, watch your favorite team play, and before you know it, your hair will be game ready. Open 10 to 8, 7 days a week. Walk in anytime. Lady Jane's Haircuts for Men. It's wicked awesome.
It is time for the Injury Report, brought to you by OMPT Specialists.
Welcome back to All Access Sports Medicine. This is the Injury Report, brought to you by OMPT Specialists. Dana Ponners. I know we talked about hips, but this time we're going to get into an accident, not accident, injury. Why did I say accident?
Yeah,
I don't want to get in an accident. Let's get into the injury of Justin Moore, Villanova's point guard. I believe point guard. I mean, I'm all mixed up there.
We got our facts out.
There it is. Justin Moore coming down. Actually, this was in this is a Elite 8 matchup, I believe.
This is to get into the Final Four.
Yeah.
So, for those of you that are listening to us, we're watching the video of Justin Moore dribbling around. He ends up doing a push-off. Bam, falls down on the ground. Push-off, immediately down on the ground. Right leg. So let's look at one more time. Take a peek.
Yeah, I mean, how much time's left in the game? It's like the last.
It's 44 seconds.
And they're up by 4, so he should be in the game. I mean, again, it's like we talked about the player from Michigan. It's just there's no contact, there's no injury, nobody's pushing on him.
No slip.
It's just an unfortunate event. And like Dana pointed out when we talked about it last week, was he predisposed? Did he have this doesn't just happen on a healthy Achilles tendon. Was he predisposed? Was he already having tightness? I mean, what was going on? And we went through it pretty well last week. What I want to talk about this time, and I think this is the direction you were going, although I'm guessing.
Go ahead.
Do we have the actual?
Yes, we have Kevin Durant's, or do you want the actual?
Well, I want to go through the anatomy in case people missed last show. The anatomy worked out really well. When you
go ahead.
All right, we'll work on the anatomy as I'm talking, and then we have Dr. Carroll here who can comment also. But the Achilles tendon is a serious injury. We saw Kevin Durant get it. We saw his recovery. We saw him re-injure. We saw him take an extra year off. But again, that's Kevin Durant. What did he put up, 41 against the Pistons the other day?
I might be able to put 41 against the Pistons. I'm just going to say that out
there. But we'll give it the benefit of the doubt that Kevin Durant is a little bit above that. But, I was asked, what's his recovery? Like Darren was pushing, what's his recovery? And I kept saying, Kevin Durant at 90% is better than 99%. I'll say it here also. For this young gentleman who's he's missing the Final Four.
Yes.
It could make the difference between Villanova being competitive against Kansas City and fighting Kansas.
I took them winning in my pool too.
Which one, Villanova?
Yeah, winning the whole thing. I know.
Can you double down?
Hold on. Can we not just say, "Oh, it's done"? Come on, guys.
He's done for this season.
He's done, but Villanova's not done. You can't just rule
right, we're not
them out.
Get into the...
Don't get me wrong. He is their main player. I think we talked about the anatomy of the Achilles last week. You did mention the
avascular zone.
Correct. Let's get into that.
So there's a little avascular zone where there's not as much blood vessels, so that means there's not as much healing that can occur. So let's say he had a little irritation because it's the end of the season. He might have a little, you could call it tendonitis type thing. Mm-hmm. He's already predisposed then. And this area is about 2 to 6 centimeters above the heel. I don't know where it was. But that right there could be a pre-existing condition, like just have it go out like that.
Yeah.
Just enough to have the collagen not stable enough to handle the push-off.
Another question I have is we talk about preconditions if it is maybe not as strength or strong as it happens at the end of a game like this. You've been seeing a lot of those I'll call it massager guns. You know those massager guns? The Theraguns. If someone is constantly doing that to themselves, constantly on their legs, I mean, could that
That was real sound effects.
That's what it sounds like, right? But
no, you're right.
That cause tears, miniature tears that in the long end.
I mean, actually using it could cause, or because he's using it, there is
using it too much.
No, that's
really.
I mean,
it's vibration.
It's vibration.
Okay.
I mean, it shouldn't be causing the micro traumas. I mean, I thought you were going to mention that they're doing it, so they're already predisposed because they are already showing proper that their mechanics are off and things like that. Yeah, or are we using it for healthy tissue to maintain healthy tissue? Because you've trained, you've been in sports, you know what beginning of the season looks like, you know what end of the season looks like. I mean, this is a great tool. I love the Theragun because it is massaging deeply into those muscles, and you're getting, we always want to be as healthy as possible, so it's a positive. But your point of if he's seen on the sidelines, his Achilles was tight, his calves were tight. Is it predisposed? Like I said, when we examine them on, at Michigan Sports and Spine, we try to do that preventative look. We don't look, where's the pain? We do a comparison. So we talked last time, how much does his ankle move up and down? Where's the restrictions? Where's their tenderness? I could probably push on your Achilles right now and probably find at least a couple areas of tenderness.
Yes.
And just pinching the back of it, it's kind of it's a pseudo red flag if it's very tender. If you just do a light pinch one side over the other to the Achilles tendon in the back there. And there is the avascular, so there is a lack of healing if there is an injury. But you're talking about end of the season, guys are pushing it. You don't expect kids this age having these tears. So what's going on? I can go as far as supplements.
Yeah. Okay.
These kids, I don't want to get into it.
Nutritional facts?
No, just I need a little boost. I need a little extra.
Okay.
Kind of, some of those things make tendons a little bit more brittle. You got any comments on that, Tom?
Yeah.
He doesn't want to jump in on that.
I want to know where you're going with this.
Where are you going with that? I want to hear this.
It depends on what kind of supplements you're talking about, but there are definitely some medications that predispose tendons to tearing.
Yeah.
So it just breaks down the tissues, or
let's just keep it at brittle because we'll get into a whole long discussion.
Okay.
But
remember, these are everyday people listening to our show.
No, but when you talk about these supplements or rehydration or drinks they're doing, there's stuff in there for quick rehydrations. Some are good for the recovery and some are speeding up a little bit faster.
Okay.
Steroids, like we mentioned, steroids is not technically good for the ligaments for long-term use.
Yeah, remember Cipro antibiotic?
Yes.
They predispose you to tendon tears.
Yeah, and statins too. So I don't think he was on either one of those, but for our older population, those are things you have to worry about. That's why it's so important to keep the body healthy. Could this have just been an unfortunate moment? Yes, it's an unfortunate moment. The way we look at it, it's like, God, that kid's healthy. Look how ripped he is. And, you got kids crushing it, leader on his team. There had to be something else there. And that's, and then we talked a lot about the injury, but I do want to get into the recovery because we ripped on it and you're here. Do you do many Achilles repairs?
Yeah, quite a few.
And it's the rehabs.
Yeah, it's tough rehab. I would say you're probably 80% at 6 months, but really not 100% until probably a year.
Now,
hopefully,
that's my thing. Are we saying 100%? Or are we saying 100% because you can go back out and put yourself in that high-end athletics?
I talk about function. Just your function. It takes a full year to get it back.
Yeah.
So you're taking function at an elite level of I'm going to compete.
Yeah.
Hopefully.
Exactly.
And he, Dr. Pierce also brought up if it was a full tear or just a partial, and full tear is better than a partial, right? Or is that what I not learned last week?
Well, no, you confused it.
Come on. Well, hear me out. Come on, help me out here.
Sometimes a complete tear is better because you go in and surgically repair it.
Yeah.
Sometimes when there's a partial tear, then we got to go degrees of partial tear, and you can speak better. I mean, I deal with the more non-surgical.
Correct.
So if we have mild tears, and that's where we'll put regenerative
Correct.
PRP therapy, rest, all those things. A complete tear, you need surgery. There's no debating. Partial tear, then we'll go on, is it 50%? Is it less than 50? If it's more, you can partially repair it. It is better, but it depends on how those strands are that are remaining.
I was just about to say, you guys talk about preconditions, things like that. If I have a partial tear and then we, okay, let's get it rehabbed. In my mind, every step I take could be that full tear. That's what's going on in my head.
Dr.
Yes
Carroll?
or
Yeah, that's certainly a possibility, and it happens. I can't tell you how many people I've taken care of with partial tears that turn into full tears, but also I would say the majority of patients with partial tears end up healing no surgery, so it's definitely a little bit of a crapshoot.
Yeah, it gets down to the percentage of tear.
Well,
and what they're doing.
And then when you diagnose these, are you using more ultrasound than MRI? Like, how do you go, I know the technology of diagnosing the tears and that, is that a big deal, like using something like an ultrasound over MRI or something, or both?
Yeah, the literature is pretty solid on this. That ultrasound for this type of injury is very good, and we have an ultrasound in our office. I'm sure Dr. Pierce has one too, and it's very easy to make a diagnostic ultrasound to confirm your diagnosis. But I'll tell you, if you see enough of these, you can tell pretty much by the physical exam and the history what they have.
Right. Yeah, I mean, MRI, ultrasound, musculoskeletal ultrasounds, both of our offices do that. So it's a sad thing.
It very much so. And I definitely do want to say, Dr. Carroll, truly appreciate you coming on board today, being that thought leader of the week. It's been such a pleasure. Thank you so much for coming on
Thanks
today.
for having me. Appreciate it.
That was the injury report brought to you by OMPT Specialists. OMPT Specialists are dedicated to providing you the best quality care by applying one-on-one customized treatments with the same highly skilled physical therapist for each visit. Each therapist is certified in orthopedic manual physical therapy, or OMPT, an advantage form of physical therapy that focuses on treating the cause of pain, not just its symptoms. To schedule an evaluation, call them at 248-353-1234 or visit them online at omptspecialist.com.
Gain more confidence in your body with LightRx. We offer non-invasive treatment options like laser lipo, laser hair removal, and body contouring that deliver dramatic results with no surgery or downtime. Our expert staff will help you find the services that best fit your body goals. Save 70% on our favorite treatment plans and get ready to look and feel like your best self. Visit lightrx.com/Woodward Sports to learn more about this limited time offer.
Give it up for the hero of the month on All Access Sports Medicine, brought to you by LightRx.
Welcome back to All Access Sports Medicine. Again, this is my favorite part of the show. Always.
I think you're consistent every week too.
And I always say this. This is my favorite part of the show.
Poor Dr. Carroll's right here.
What? You know what? Favorite part of the show, Hero of the Month. Charity is going to be Athletes Unlimited. This is the last week that we're going to be showcasing them, but of course not going to not stop talking about them.
Absolutely.
But this week we have Amen Aliseri. Correct? Did I say that right?
I had to correct you. I'm even on air. I had to, man.
That's perfectly fine. Truly appreciate you
of course,
coming on
thank
again
you guys
today.
for having me.
And so I do want to say we have you here because of Athletes Unlimited, because you were a previous Konstantinov scholarship.
Yep.
Okay.
Yeah.
Tell me a little bit about that and kind of how you've worked together with Doc, not only with Athletes Unlimited, but also just in general.
Yeah. I got to go to the University of Arizona to play wheelchair basketball, and Dr. Pierce was kind enough to grant me an Athletes Unlimited scholarship, enabled me to do that. So thank you for doing that, Dr. Pierce.
No, that's what we were you.
Also, I'm really glad that you guys don't have a chair on stage for me, because I really wanted this chair here. So,
and
you look good.
Thank you. Where can I see myself? Oh, okay.
Yeah, there you are.
Look at myself while I speak. Thank you, Dr. Pierce. Thank you for letting me know I have a visual.
So you went to Arizona.
A little bit over. No.
I'm no longer going to make eye contact with you guys. I'm going to
just keep looking at
on the screen.
True narcissist right here, just constantly looking at himself.
He's looking at a comedy career. We might as well throw it out there first.
Sure,
hold on. So, wait a minute.
He wants to do stand-up.
Are you kidding me?
No.
You got
no, man.
We're going to save it to the end, but we want your best one-liner.
Not save it. I want it now.
All right.
Give it to me.
Oh, you want a one-liner now?
This guy, put him on.
Put it on Dr. Pierce.
Yeah, like Chris Rock.
Look, this is
like
no
Chris
Oscars.
Rock and Will Smith.
Do not cross the line here.
You know, Dr. Pierce you and Will Smith actually do have some things in common. You know, you definitely would have reacted the same way had somebody said that you can no longer wear quarter zips.
He is the quarter zip man.
You definitely would have smacked the bleep out of Chris Rock had somebody told you not to wear quarter zips anymore, or had they kept you from attending Faster Horses Music Festival. One or the other.
Are you going to get up and slap him in the face
No,
right now?
I appreciate the humor. I actually got, there's a follower that follows us, and he sent me a picture today. He's a friend of yours.
Me?
He says the king of quarter zips, and I'm claiming it.
It would have been nice to have you host the Oscars. At least you would have been able to offer Jada some stem cells for alopecia. You would have been able to offer some kind of treatment. It would have been nice to have you up there.
We try.
Okay.
Here at All Access,
He
we're
might
here
make
to
it,
help.
man.
He's going to do it.
He's gonna make it.
Make sure you don't sit in his front row at his show.
So we're just in the beginning stages or what?
Yeah.
That was
so
his
I started
throw to
like
try to give it Faster Horses an opening act just now.
This guy?
started.
Yeah, he's throwing that little carrot out. You got to know this guy.
I'm trying to get my networking in too, guys. I'm not just here as the hero of the month. I'm really doing this for selfish reasons.
True narcissist, like I said.
But yeah, no, I recently started, man, about like 5 months ago. It's always something I've wanted to do. Like I love stand-up comedy. I dealt with an injury actually that kept me off the court for a while.
Okay.
And like I feel like I just had to channel my energy somewhere else, just because I wasn't able to get on the court, and I always wanted to do that. I needed to find fulfillment somewhere else, so I decided to pursue it, man. It's been great so far.
So you're just gonna leave your current day job and go into comedian?
So if that's I don't want to.
Yeah, I don't want to cause any trouble.
I'm not gonna name my employer. I don't want them thinking things or start pushing me out the door too early.
That's right.
But no, I mean, if it comes to that shit, I'd love to, man. It's been a dream of mine. So.
All right.
Yeah.
If you're any good, I have a few connections. So
please, yeah, I'd like.
But
yeah.
let's back up a little.
Yeah,
Let's
go
get
ahead.
back to Athletes Unlimited. And you did talk about that. Your career as a high schooler was great. You were phenomenal at wheelchair basketball to the point that we were able to give you the scholarship, but you got that scholarship and that degree through the university. So you were able to play basketball at the highest level, the elite level of college, and then produce the career and the financial support that you have now to go pursue that community comedy career.
So it really wasn't just me going out there to play basketball. You guys, it was after basketball, like after playing college basketball. I didn't go like the professional wheelchair basketball route, but you guys, like you said, you created that financial security because I was able to get a degree doing that. Mm-hmm. So it worked out in both regards. I was able to I was able to pursue the thing that I loved in wheelchair basketball, and I was able to gain some level of financial security for the rest of my life.
So every athlete we have from Athletes Unlimited, you guys are good looking, in shape and everything. And people think they don't realize what your disability is. So
I was waiting for you to say that stops at me. The good looking part.
I did, but you already threw the first punch. So I don't want to think like I was just retaliating.
I think he's just, you know what? Do you just want to be the host? You just want next week? You just want to come up here?
Am I doing too much here, Adam?
No, I love it. Keep going. So yeah, a little bit about yourself. Yeah,
we're going to talk a little about yourself as far as your disability and how you
absolutely
became.
So I suffered a spinal injury, incomplete spinal injury when I was 13. It was a stray bullet. It was a gunshot wound. Just wrong place, wrong time. So it's an incomplete spinal injury. So my right leg is still okay. You guys see me walking up here with this cane. I have a knee, ankle, foot orthosis on my left side. So I'm able to get around pretty well, and my mobility is pretty good compared to somebody who would have suffered a complete spinal injury. But obviously it is permanent.
Right.
But yeah, no, like I'm really lucky. It's something that I don't even think about anymore. Really, like the injury. It's just part of who I am.
It's part of who you are.
Exactly.
It's part of your comedy routine in the future.
Yeah, absolutely. It's
you can't play the sympathy
actually.
card to get jokes. Then,
I think I lean on it a little too much.
Now, just understand, he's talking about a brace that supports his left leg. Incomplete. We talk about the spinal cord. So there's complete where he doesn't have any feeling. He has a partial here. Fortunately, he still has full use of his right leg, but you still have had muscle development issues on the right, or you're just skinny anyhow?
No, so on the right side, yeah, it's still really sensitive. It's still really sensitive to the touch. And yeah, like the muscle development issues for sure, but it's not nearly as bad as the left side. Like I'd like to think I'm at like 70% of what I was when I was able-bodied on my right side, at least.
Are you still playing wheelchair basketball somewhere?
I'm not because of the injury mostly. It still affects me.
Okay.
And it's such a high-intensity sport, and I want to play it at the highest level.
Yeah.
So if I'm playing, I don't want to just play like once a week recreationally. If I'm in it all the way. And I can't do that right now. So that's kind of why I'm pursuing this comedy thing full time, because I need some kind of hobby or something that I'm really passionate about.
And I'll tell you what, you were probably one of the most passionate people that I've ever met.
Thank you, Adam. Appreciate it, man.
Yeah, I mean, as far as like for the listeners, Athletes Unlimited, we're a charity for impaired athletes, and you've been an inspiration to a lot of young players, and I don't know how much you're involved. We had the junior wheels here last week. They were phenomenal.
The game's today.
Huh?
Game today.
Yeah, game today. So they're in the
they're actually at Nationals right now.
Yeah, everybody's at Nationals in Wichita,
yeah,
the homeland.
Shout out Detroit Wheelchair Pistons. Good
Zeus.
luck, guys.
Shout out
number
Zeus.
one seed in the country.
Yeah, number one.
Yeah.
The best team in Detroit.
Yeah.
But yeah, I mean, as far as what to do, talk to parents. Your life, how it changes from age 13 moving on. I mean, that was, struggles, and you found different outlets. Like you said, you need your outlet now. Messages that we've had. The biggest reason I got into Athletes Unlimited and developed this charity is before those, to have that outlet that, our statement, it's not, we're not here to be a spectator sport. You want to be involved. So, I mean, what would you say out there to inspire these young athletes that are able and disabled?
Yeah, as honestly, as corny as it sounds,
glad you clarified.
Don't give up. Like, really, just like, because it may seem like it seems like it's a really long ways away to reach any kind of success. But if you find yourself just looking 5-10 years down the line instead of taking it day by day, you're really putting yourself in a hole. So you will get, if you like really grind for those. I know I don't want you to look down the line like 5 to 10 years down the line. Don't project your current self into the future. But if you don't quit, if you're grinding every single day, I promise you 5, 6, 7, 10 years down the line, you will see some form of success. Obviously, like, this is coming from somebody who's only 26, so I don't want to sit here and preach to a bunch of people older than I am who have probably seen.
But you have. I mean, you could have curled up and did nothing at 13 and been sorry and
and
it was just like not really, made that way.
And it was really so the point is, like, it was really tough at first, but. And I didn't. This was kind of inherent. It was unconscious. It just happened. I found this out not by knowing that early on. Like, this wasn't a conscious thought that I had when I was 13. Like, hey, don't give up, keep going, and then you're gonna be okay someday. You're gonna find some kind of success. It kind of just happened naturally. And then now I'm like, that's just the way it turned. That's what I gained from this entire experience. It's just
perseverance.
Yeah.
We got 1 minute. You got one more joke for Adam?
Oh, don't do that.
I mean, dude, he's got to be fair. You can't pick on Dana.
Don't do it.
No,
I might stand up.
All right, just give us some.
I think taking over as host for Adam was enough.
There it is.
I think taking his job for like the last 10 minutes, I think that was enough. I think.
We appreciate you coming on today.
Thank you so much for having me in this fancy studio.
Being the hero of the month, Athletes Unlimited. You are always welcome anytime to come on board.
Thank you so much. It was great. It was
tell
great
jokes.
being on. Thank you.
Try my
I'll come better prepared next time.
No
in the jokes department. Thank you so much for having me.
Thank you again. That was the Hero of the Month, sponsored by LightRx. Gain confidence in your body with LightRx Face and Body. LightRx offers a non-invasive treatment options like laser lipo, laser hair removal, and body contouring that deliver dramatic results with no surgery or downtime. Right now, get 70% off on any treatment plan to get ready to look and feel like your best self. Visit lightrx.com/Woodward Sports to learn more about this limited time offer. And that is, again, another episode of All Access Sports Medicine. Dr. Pierce, so happy to have you here today. Thank you so much for coming on.
Yeah, Dechambeau, we're sorry. We're just here to help.
Didn't you want to say something about Will Smith?
We did. We put it in there.
Okay, you put it in there. Okay.
We put it in there, girl. Don't you worry. I put it in
there.
He
refused to play the clip, but
we played the clip too. Dana, thank you so much for coming on. And then again, also Dr. Carroll, thank you. Appreciate it. That's All Access Sports Medicine. See you next week.
Peace out.